Hi, my name is Nina Livingston. I'm a child abuse pediatrician, and I direct the Division of Child Abuse Pediatrics at Connecticut Children's.
Hi, my name is Ashley Starr-Frechette. I am the Director of Health Professional Outreach at the Connecticut Coalition Against Domestic Violence. We are the state's leading voice for survivors and the agencies that serve them.
So I began my career as a general pediatrician in community health settings. And back then I was screening new moms to my practice for domestic violence. And what I found was that 30% of them were telling me about past domestic violence relationships, but no one was acknowledging any current domestic violence. And that was my first clue that women were not really comfortable telling their new pediatrician about being in a violent relationship. Fast forward to when I became a child abuse pediatrician, I started working with families all the time who were experiencing domestic violence, but most of them still didn't really want to talk to me about that. And what we found was that we started putting up tear sheets in the exam rooms with the domestic violence agency information on little tabs, and they were just being torn off at an alarming rate. Our MA, I remember, said that she had to put 2 up at once so that they wouldn't all be gone by the next time she did stocking. And that was another clue for me that this was an incredibly important issue for my patients. So back in 2015, I had the chance to sit on a statewide task force around the impact of domestic violence on children. And coming out of that, some of us at the Children's Hospital got together with some of the people from the State Domestic Violence Coalition and started a more formal collaboration through our Office for Community Child Health at Connecticut Children's.
This collaboration started a while back, and it's been an extremely important collaboration for our domestic violence organization here in the state of Connecticut, because our 18-member organizations are working with families on a daily basis, and we're always looking to add resources and supports for those families that are coming in and out of our services. This collaboration has allowed us to gain connections that we didn't otherwise have. We've been able to really focus our supports for children, and it has really allowed us to expand our reach to address violence across the lifespan.
On the Children's Hospital side of our partnership, we have participation from members of our child abuse team and our injury prevention team, including me as a physician, a licensed clinical social worker, and a PhD researcher as primary participants. We also have been able to pull in some other specialists in our system, including child life and people with expertise in children's mental health and protective factors to help us on some of our projects.
Our partnership model is that we meet on a monthly basis. We meet virtually, and we talk about different updates or projects that we're working on. We also have subgroups that will meet sometimes intermittently between those meetings just to catch up on other things that we might be working on. We come together using in-kind resources currently at this moment. Other times we do find smaller grants or donations that have been really helpful to support the work that we're doing. Our key collaborators here from the Connecticut Coalition Against Domestic Violence are our CEO, our Director of Health Professional Outreach, and our Director of Child Advocacy.
From the pediatric side, we've been able to access the expertise of domestic violence advocates and survivors and bring that information into our practice. We've also learned a lot about local resources so that when we have families in need in clinic, we're more often able to make a warm handoff to a domestic violence advocate in the community.
This collaboration has been incredibly helpful in the fact that it's connected us to a population that we didn't otherwise have many connections with, which was the pediatric care setting. So through this collaboration, we've really benefited from being able to connect to those individuals that we maybe didn't have much pull with, and we've been able to connect each of our 18-member organizations to resources through this collaboration and the information we've gained from working with pediatricians.
As healthcare providers, we don't receive a lot of training about domestic violence and how to respond to this problem in our practices. We just don't have the expertise that our domestic violence advocacy partners have. But our families need access to these resources, and through this partnership, we can connect them.
This collaboration has been crucial in the sense that we know that the well-being of the parent or the adults or caregivers is really beneficial to the well-being of that child. So through this collaboration, we've been able to kind of emphasize and expand on that. And we've also really been able to help increase the education and programs available to our child advocates who work in each of our 18-member organizations. So we've really gained a lot of knowledge, trainings, and resources through this collaboration.
Just reach out and start the conversation. This is part of our work as pediatricians. You can call your local domestic violence coalition or your state domestic violence coalition and let them know that you want more information and that you're there and want to be part of the conversation.
First and foremost, pediatricians can take the opportunity to make a call to their local member organization or look up their state organization, their domestic violence organization, connect with an advocate that knows their area or their state. This way they can possibly set up a virtual or in-person meeting for each other to get to know each other's services. Because pediatricians can benefit from domestic violence services as much as domestic violence services can benefit from the education that pediatricians might be able to provide.